Welcome to Nurse Horizon channel. Let's have a quick revision of pediatric nursing. For more videos, please subscribe our channel and press the bell icon for more notifications. Question number 1. Which of the following is true regarding pathological jaundice? It occurs after 24 hours of neonatal life. Bilirubin rise of more than 5 mg per deciliter per 24 hour. Bilirubin level up to 12 mg per deciliter in full-term neonate. Bilirubin level up to 14 mg per deciliter in preterm neonate. And the answer is bilirubin rise of more than 5 mg per deciliter per 24 hour. Let's have a quick review of the difference between physiological and pathological jaundice. As we all know that physiological jaundice always occurs after 24 hours. Say simply we can say on the second or the third day of the life. However, in case of pathological jaundice, it may occur at any time, even in the first hour, most commonly before the 24 hours of birth. Now, regarding the bilirubin, up to 12 mg per deciliter can be considered as normal in physiological jaundice. However, more than 12 mg per deciliter will occurring in a full term, causing pathological jaundice. Now, in a preterm, up to 14 milligram per deciliter may occur in physiological jaundice, and more than 14 milligram per deciliter may occur in preterm baby in case of pathological jaundice. So let's question number 2. Surfactant replacement therapy is done through, and the options are intravenous injection, subcutaneous injection, intramuscular injection, endotracheal instillation. And the answer is endotracheal instillation. Surfactant therapy is done in respiratory distress syndrome, which is manifested as nasal flaring, tachypnea, and chest retraction. So it is given an endotracheal instillation. Question number 3. A pediatric client diagnosed with basilar skull fracture. Which of the following should not be done? And the options are daily weight, suction as needed, provide clear fluids, maintain a patent IV line. And the answer is suction as needed. Why? Because the suction catheter may enter the brain through fracture and lead to secondary infection, so suction cannot be done. Question number 4. Which of the following precaution should be followed in a client with meningitis? And options are maintain respiratory isolation at least 24 hours after initiation of antibiotics. Option B, no precaution is indicated once antibiotics started. Option C, enteric precaution. Option D, isolate the client till CSF is clear. And the answer is option A, maintain respiratory isolation at least 24 hours after initiation of antibiotics. The rationale: respiratory isolation for at least 24 hours while cultural results are obtained and antibiotics is offered. Question number 5. Which of the following is a sex chromosomal anomaly or XXY in males? And the options are Turner syndrome, Klinefelter syndrome, Down syndrome, and Edwards syndrome. Answer is Klinefelter syndrome, in which there is an extra addition of chromosome in males. Now, trisomy 21 is called as Down syndrome, trisomy 18 is called as Edwards syndrome, monosomy less one chromosome X0 in females. Question number 6. Which of the following indicate worsening of acute asthmatic attack? And the options are pulse rate of 96, respiratory rate of 22, decreased wheezing, warm and dry skin. And the answer is decreased wheezing. Rationale: decreased wheezing in asthmatic attack may be misinterpreted as a positive sign. However, it may be a sign of inability to move air, which is called as silent chest. Question number 7. Which of the following indicate airway obstruction in a client with epiglottitis? And the options are nasal flaring and bradycardia, tripod posture, low grade fever and sore throat, foul smelling discharge from the nose. And the answer is tripod posture. Leaning forward with hands supported anteriorly on knees is called as tripod posture, which indicates an airway obstruction in a client having epiglottitis. Now, foul smelling discharge always indicates the presence of a foreign body. Question number 8. Omphalocele is, options are herniation of abdominal contents through umbilical ring, extrophy of the bladder, herniation of intestine lateral to umbilical ring, soft swelling or protrusion around the umbilicus. And the answer is herniation of abdominal contents through umbilical ring is called as omphalocele. Now, extrophy of the bladder is also called as ectopic vesica, and herniation of intestine lateral to umbilical ring is also called as gastrocsthesis, and umbilical hernia is called as soft swelling or protrusion around the umbilicus. Question number 9. Which of the following is false regarding patent ductus arteriosus? And the options are failure of ductus arteriosus to close, machinery like murmur, option C indomethacin is given to close the PDA, and option D hypercyanotic spells with squatting position. And the answer is yes, as we all know that in tetralogy of Fallot there is hypercyanotic spells with squatting position. All the options are true regarding patent ductus arteriosus. Question number 10. Tracheoesophageal fistula is characterized by all of the above, all of the options except option A, drooling of frothy saliva from mouth and nose, coughing, choking and cyanosis, inability to pass orogastric tube into the stomach, olive-shaped mass in the epigastrium. Questions are which is true regarding tracheoesophageal fistula except, and the answer is yes. In pyloric stenosis, as we all know that olive-shaped mass in the epigastrium is a characteristic finding. Question number 11. Ribbon-like foul-smelling stool is the characteristic feature of, and the answers are, options are Hirschsprung disease, celiac disease, pyloric stenosis and indissusception. And the answer is Hirschsprung disease, which is also called as congenital aganglionosis. And gluten intolerance is a characteristic finding in celiac disease. Olive-shaped mass and projectile vomiting is a characteristic finding in pyloric stenosis. And red currant jelly stools and sausage-shaped mass can be seen in indissusception. Question number 12. What do you mean by Reyes syndrome? And the options are acute encephalopathy followed by viral infection, failure of closure of neural tube, protrusion of meninges in the back, then imbalance of CSF absorption and production. And the answer is acute encephalopathy followed by viral infection. And failure of the closure of neural tube, also called as neural tube defect, as we all know that it is called as spina bifida, and protrusion of meninges in the back, it is also called as meningocele, and imbalance of CSF absorption and production, it is called as hydrocephalus. Question number 13. Which of the following is a priority in a child with pneumonia? And the options are nutrition, exercise, rest, and regular bowel habit. And the answer is rest. Why? Because rest reduces the oxygen demand and minimizes the metabolic needs of the. Question number 14. Which of the following is a most serious complication of meningitis in children? And the options are seizure, hydrocephalus, bilateral blindness, peripheral circulatory collapse. All these four options are complication. The question is most serious complication. And the answer is peripheral circulatory collapse, which is also called as Waterhouse-Frederickson syndrome. It is bilateral adrenal hemorrhage. It causes acute adrenocortical insufficiency leading to petechiae, hypotension, and profound shock. Question number 15. Which of the following assessment is suggestive of cystic fibrosis? And the options are sternal retractions, abdominal distension, rapid crying, and excessive crying. Here we are going to end the video of quick challenge in pediatric health nursing. So let us go for the last question and the last answer. The question is, which is most indicative of cystic fibrosis? And the answer is abdominal distension. Why? Because in cystic fibrosis, the small intestine is blocked with thick and tenacious mucilaginous meconium, causing intestinal obstruction and abdominal distension. Let's go for a quick review that we already learned regarding newborn assessment. As we all know that heart rate of newborn is from 100 to 160 beat per minute, respiratory rate from 30 to 60 breath per minute, temperature is 96.8 to 99 degree Fahrenheit, blood pressure in the newborn is 73 by 55 mm of Hg. Let us go for some of the body measurements of the newborn. Length is around 45 to 55 centimeter. Weight is 2.5 to 4.3 kg. Head circumference is 30 to 35 centimeter, whereas chest circumference is 30 to 33. Please note that chest circumference is less than head circumferences, and the mid-arm circumference is 8.2 to 9.7 centimeter. Thank you for watching the video. For more videos, please subscribe our channel and press the bell icon for everyday notifications. Stay tuned for 15 minutes for a royal road to your success. Thank you.